information that we are going to have. So without further ado, I would like to introduce you to Dr. Woody Kessel. Woody Kessel is a community pediatrician and child advocate with experience in bioengineering, medicine, public health, community-based programming, and public policy. Previously, Dr. Kessel served in the U.S. Public Health Service as an Assistant Surgeon General and Senior Advisor on Child and Family Health Matters to the White House, Cabinet Secretaries, Surgeon Generals, and Health and Human Services officials, spanning 8 administrations. Dr. Kessel has been involved in setting child health policy, including the Children's Health Insurance Program guidelines for health supervision of children and adolescents, preventing childhood obesity through federal initiatives, and community-based research, helping grandparents help their grandchildren make healthy choices, and the Healthy Start Initiative to reduce infant mortality in the U.S. He is definitely one distinguished man, and it is really my pleasure to have him here talking to you this afternoon about the best kept secrets in academic success. Thank you, Woody.
Thanks, Michelle. Can you all hear me? I like to wander around a little bit, so it's going to be a challenge for the folks watching. I'll have to keep my movements to a minimum. First, I want to thank the American Dairy Council. Educating all of us about the importance of good nutrition and its relationship to health and its relationship to academic success and just good health is critically important. So thank you for all of that. You know, the best kept secrets of academic success really fairly simple. It's parents, it's teachers, it's the schools, it's you. I mean, the idea that we're going to be talking about, you know, food and nutrition is certainly critical and important, but in fact, we shouldn't leave out the whole process of the community and the parents and the kids and the faculty and the administrators and the food service people. Now we're going to change their name to culinary service folks, so it just takes on a different impression. But I do want to indeed talk to you, and I'm going to reinforce some of the messages you heard a little bit earlier in the process. You heard all of my summary of my career, and you know, it's a little like I've had so many jobs I couldn't keep one in that process. But I bring this to you because this is the paradigm, this is the model for public health. And to oversimplify it, it asks 3 basic questions. What's the problem? What's the solution? And a very important one that often is forgotten, what happened? What was the result? The accountability, the follow-up, the follow-through. So it's an iterative process. What's the problem has to ask the question in a sophisticated enough way that you get information about a good solution. But then accountability is looking at how that solution worked or didn't work and feeding that information back. So it's sort of a continuum in the process. The principles of the public health approach, and this applies to a whole variety of challenges, it really talks about prevention. The key in all of this is we want to prevent problems. Even though I'm a pediatrician, and the emphasis is on, at least in medicine, is on treatment. It's sort of on after the fact. But as pediatricians, we spend more time on trying to promote good health, prevent untoward consequences, and I think that's what all of us in here are about, is the focus on prevention. Certainly using good science, and you've heard some of that good science. I'll go into a little bit more of that, but it's got to be based on good science, and it takes all of us. It does take a community. You know, that fancy word, we use that all the time. It does take a village, and certainly Rochester is a big village, but you're all from different communities here, and it does take all of us together to work on these kinds of challenges and have successful solutions. And if you look back, the Centers for Disease Control looked at what were some of the big successes in the last 20th century. And it looked at immunizations, for example. And my students don't see those diseases anymore. They can't recognize diphtheria, pertussis, tetanus, polio. We take them for granted. But equally what's interesting, and it's part of our challenge, is that there's questions about whether some families are not getting their kids immunized. That's become a real challenge, how to talk about effective therapeutic interventions that are, of course, children wince, it hurts. Nobody likes a needle. We'll solve that technological problem hopefully sooner rather than later. But it's dramatic to see the changes that our successes have made in immunizations. And I think this is all part of the challenge that we're doing. The difference for all of us in this room is we eat 3, 4, 5 times a day, so that the challenge is a daily one that we have to sort of continue work on. But it's just sort of interesting. It's interesting to look at, some of the ones, successes in public health. Lead paint. Frankly, farmers knew about the untoward consequences of lead paint much sooner than we did and appreciated it in children. They observed it in animals. The pens were painted, pens meaning the corrals or whatever it is, not the pens, were painted with white paint. And the animals would chew on it. And you saw the animals suffer the consequences of lead poisoning. It took many years for us to realize and ban lead paint as a pigment. But it's just an interesting example. Car safety seats, thank God, a wonderful success. But it's a complicated one and involved the kids. I point this one out because largely we will all wear our seatbelts now because the kids say to mom and dad in the front seat, "Did you buckle up?" So it's really become part of the norm, and it's really changed lives dramatically. Cigarette smoking, while it's a big success, it's still a challenge. It's still an ongoing challenge. If we look at underlying causes of death, we still see tobacco as the leading preventable cause of death in this country. It's still amazing that that behavior, that product, I often joke if we could figure out a better use of the tobacco plant, there's got to be an economic win-win in this circumstance. We wouldn't use it as a smoking product that causes all the illnesses, diseases, lung cancer, etc. But look at number 2. And these data were put together to look at underlying causes instead of the international classification of diseases. Most of us, tragically, the number 1 cause of death in this country is cardiovascular disease. But that's related to what? To cigarette smoking and nutrition. So if we're going to do something about some of these things, you have to look at some of these underlying causes. For me, this is a very painful slide. This is reiterating what Jessica talked to us about. It's embarrassing, upsetting, and incredibly disturbing that nearly half of America's children could be what I call malnourished in this country. I mean, I'm adding them together. They're not linear in that regard. You can't simply add them together. There's relationship between food insecurity and overweight and obesity because of the poor quality of the foods that kids are eating. They're calorically dense. They don't have good nutrients, so you can be food insecure and be overweight at the same time. But if I just add them together, and if you look at I'm short, so I can't see. Oops, what did I do? Pressed the wrong button. If you look at I realize that Fuel Up to Play 60 is a critically important program, and it's wonderful that the National Football League and the teams have all gotten together to encourage better nutrition and good physical activity. But everything has to be done in balance, in a system that works well. Bulking up, like some of these pictures show is a serious problem. Because if the kids bulk up to join and play football, it's hard to lose that bulk. And in fact, we don't talk about much about this, but football players have a shortened lifespan because they're on the battlefield every Sunday. I think Monday night and Thursday night as well. And while they consume a lot of calories, they are also putting their bodies at risk. And a lot of the issues here is, in some ways, athletics is a pyramid scheme, right? You want to become part of it, and you try to get the skills, and you bulk up. And then once you bulk up and don't make the team, you've got another challenge. I'm just adding to the challenges that we all have, frankly, in this room together. Also, this issue about the quality of our intake. And that's why our conversation here is so important. It's not just about the calories, so to speak. It's about what we eat. And also, I think what's missing in this particular set of slides is the importance of sharing food. We just had lunch together, and we had conversation. We talked about what we're doing. There's a social interaction that's also critical. And frankly, we don't talk much about that as breakfast in the classroom or breakfast after the bell. But that's another event about eating together, sharing stories, enjoying the meals together, not just consuming the calories. The other thing I think that Jessica did well is that the changing face of the challenges that we see today, it really affects all of us, all of our children. So this is a very upsetting, to me at least, challenge that we really do have to take up as a country, and that you're looking at this as folks working in the schools. It's just interesting to look back, sort of over time, the kind of things that have contributed to how we got into this, certainly, this circumstance. And this is a slide that reminds me that I had the privilege of working with Sesame Street, Sesame Workshop, and one day we were at a meeting and we were talking about kids and nutrition and better health, and they're an incredibly wonderful group of people worrying about child development. They're really a child development company, Sesame Workshop. But we were talking about enhancing food and nutrition, and I started to quiz them about what the characters ate. I vaguely understood what Big Bird ate, right? Birdseed. I didn't quite understand what Elmo ate. I didn't quite understand what the other characters ate. And then I said to them, Cookie Monster, Cookie Monster. In an interesting way, I said, no, I don't know what message that's sort of quite delivering, per se. And I basically said to them, I can tell you how you can get on the front page of the New York Times. And I said, have Cookie Monster declare, I'm giving up cookies. And they were smarter than I. That's where the idea of a sometimes food and an anytimes food came from. A much smarter idea. I mean, I was just thinking, sort of linearly, but they came out with this, and that's a much better way. It puts things into perspective. It puts things in balance. You don't want to demonize a particular food. You don't want to, you want to put things in sort of balance. And this slide just reminds me of all the challenges and how we got to where we are in some ways today. We can come back to some of these things. I think most of you know all of these things. Malnourished kids are unhealthy kids. I mean, every body system is affected by poor quality nutrition, whether it's overall health and cholesterol, and some of these are disease-based, and some of these are organ-based, and some of these are general responsibilities of what nutrition and good health is about. But it's just sort of interesting to go from sort of the biological ones, that it includes sleep disturbances. It includes developmental vulnerabilities, social problems, low self-esteem, and certainly the consequences. And all of these things are well documented. Science is what's driving these things. I mean, I've simplified these kinds of things, but we've done the research. We know the science in these arenas. Typically, in our nation, there's pounds and there's pounds. I mean, that's a little bit of a play on, we did come from England or someplace over there at some point, but we often monetize everything in this country. And even sometimes that doesn't fully drive us to a good solution, but it's important to recognize how, at least obesity as the example, is a huge expense in terms of the health consequences. So there's benefits all along the continuum for good nutrition and certainly being active. When I say good nutrition, I'm including certainly physical activity with all of this. So, this is really just reiterating the importance of high-quality nutrition and the benefits of cognition. And part of that is simply because our brains run on something. Our bodies run on good nutrients. This is a quote from David Satcher, the 16th Surgeon General, one of my bosses, and just with the same declaration as cigarette smoking is harmful to your health based on science. David was able to talk about poor nutrition, inactivity, unhealthy weight, poor academic achievement, costs. I mean, he's just summarized what's the problem, what that challenge really is, and we're in this room all part of the solution and trying to work toward that kind of remedy. Here's the issue, just if you put it in slightly different terms. You saw a wonderful slide, earlier about how the cortex lights up just from physical activity. It's interesting how much we know a lot more about other organs than we do about the brain. The brain's a little more complicated. You can't look at it and try to get a sense of how it's working. So we have these indirect tools and indirect assessments in all of these things. But the brain, like the rest of our body, is an organ that requires nutrition, requires energy, it requires fuel for it to function properly. And all of these things are sort of well documented. This is sort of trying to get behind the words academic success. Why is there academic success? Because there's biochemistry here. There's real science behind all of these kinds of things. Again, this is, a little more detail about, many of you are learned nutritionists. When I went to medical school, it was Maynard G. Krebs and the Krebs cycle. All I learned was how many ATPs sort of materialized from the mitochondria by just metabolizing. I didn't. That was nutrition. Memorize all of that. But we know a lot more today, and physicians are not the best source of nutrition science and information. All of you are much more learned, in that realm. And frankly, even though the first word on this slide, vitamins, I learned early on the best vitamin comes from food. It doesn't come from a chemical preparation. I was most impressed when I was an intern and learned about the WIC program that I could prescribe food instead of Ferrensol, instead of a chemical to treat iron deficiency anemia. I thought, wow, what a genius idea. Prescribe food. I was fortunate enough to go on to be on the National WIC Advisory Committee later on. Jessica didn't talk much about the WIC Advisory Committee, or WIC in general. WIC differentiates itself from some of the other feeding programs because it's means tested, there's got to be a health criteria, but it includes nutrition education. What a thoughtful idea. Help people understand what they're eating, how to make healthy choices, what to do. The SNAP program, certainly, if you're starving and you're hungry, you need food, but the SNAP program doesn't have that educational component. It's getting stronger but it really is not the requirement per se. I mean, I've long advocated, I talked to the secretary about adding some of those educational components, but the WIC program is so strong. But then we talk about some of the micronutrients. We get into some of the details. But again, this is just to reinforce what we're here about is about science. It's about translating science into action that has real benefits and real results. And then we get to, what we're here mostly to talk about is, starting the day off right. It's somewhat intuitive. When I was growing up, we ate breakfast not in school. We ate breakfast at home. It was a family event. You got up early and you had breakfast. You couldn't get the day moving until you sort of had breakfast. And lives have changed, things have changed. The importance of breakfast hasn't changed, but how we eat it, where we eat it, who feeds it to us, how it's prepared, all of those things have changed. Our lives have changed, quite a bit. They're trying to manage our 25 hours in the day, even with all those tools we have in our pocketbooks and on our belts and here, there, and all over. I think it's added to that, how wired we all feel. It's double entendre, wired and wired. Maybe we should all become wireless. But just the frenetic pace that we all live in, trying to get to the next thing, the next appointment, and even in our kids' lives, between music lessons and dance lessons and sports and homework and trick or treat and all of those kinds of things, it's all compelling. So the importance of breakfast is incredible. With the amount of calories it provides, the amount of nutrients it provides, and just sort of getting us oriented. I mean, it's all logical. Break the fast. After a nighttime of hopefully good sleep. Good sleep is important too. We've learned that. It took us a while to figure that out. I'm not sure we're winning that challenge. And it has all the benefits that, this is just a list that reiterates all of the same things. This is to just try to reinforce that it isn't just a minor, let's just have breakfast. It just sort of, will get things moving. But the whole issue of better memory, better behavior, all of those issues that we've gone over, and it just reinforces those kinds of things. Quality breakfast is critically important. Most kids don't eat breakfast at home. It's just not part of what we do anymore. And interestingly enough, and you can argue about this, the schools have become not only the places of education, but they provide a whole variety of additional kinds of things. I mean, frankly, we'll sometimes during events, we'll deliver immunizations. We talked about that. The schools become a source of providing immunizations. I mean, at least there's a law that you can't go to school if you're not immunized. That's a sort of an indirect, but sometimes we will in fact take the immunization vehicle to the schoolyard or in the gym or whatever. But the schools are now taking on a bigger and bigger responsibility to not only educate the kids, but and recognizing that you can't educate the kids if the kids are hungry. And it's not just hunger and the little noises our stomachs make and those kinds of things. It really is, as I showed you, good science, good rationale, good reason for doing all of this. And then the importance of all of this is, and we have, each slide more or less, and all the slides you've seen so far have the same or similar messages. And then we talk about, we've done, frankly, a better job of school lunch. Been around a little longer. We've done a somewhat better job about that because it's a little like, when does the school day start? We've sort of, when the bell rings. So now we've got, used to be breakfast in the classroom, now it's breakfast there for the bell. We sort of catching up to all the, we changed the, in Washington you'd call it, change the acronyms a little bit just to keep up. You got to reinvent some of these kinds of things. But schools have taken on a real responsibility to take on that issue, not just of hunger and the critical issue that was mentioned earlier, and delivering sort of food programs, But the critical reason as to why it's being done is you can learn better. The education is much more effective and much more valuable and beneficial to our kids. And here's a slide simply of the same, I'm an old person now. I don't feel that old, but I'm an old person. Infographics. We have all kinds of new tools, right? We didn't have those kind, when we were all going to school, or when I was going to school, it was, largely alliteration was helpful. Everything had to begin with an A. That's how you had to remember it. Or you did it, I don't know how you got to the number 11 because you only had 10 fingers to do whatever you were doing. So, but now we have infographics, and it sort of includes other sensory modalities that we have for learning. Visually, we certainly get those messages quite quickly. And the same one here, it talks about, as I showed you on this graphic, it's the public health approach. What's the problem? It's right up here. What's the solution? We have it here called the right answer, and we've characterized them in some ways. I think the other piece that maybe I can get Michelle to add to this is sort of what happened, is that third part. What was the accountability? What ultimately was the benefits that showed up on here? But I think we're all convinced that the challenge is hunger in America, malnutrition in America, food insecurity in America, overweight and obesity in America, probably the number one problem facing our kids. I mean, there's lots of problems and challenges that we have. The schools have become the place struggling with violence. I mean, schools have become a very complicated entity these days, taking on behavioral challenges, and community challenges, and gun violence challenges. But one of the major ones, I think, is really looking at, in a holistic and comprehensive way, how can we better serve our kids and our families, provide them with a good nutrition so that they can learn and grow and become, frankly, productive citizens in all of this stuff. And again, these are just sort of the, I tried to get them all positive. I couldn't get them all in the improved zone. I worked hard at that, but changes, lateness, disciplinary problems. I mean, these are, frankly, if you were simply self-serving, and the schools struggle with behavioral problems all over the place. And starting with a quality breakfast solves some of those problems, not all of the problems. And again, we live in a society, in a community where we have to have win-win circumstances. In order to convince somebody of something, it can't just be for the inherent good. There's got to be at least two goods. So you get a behavioral benefit, you get a better cognitive benefit, you get a better learning environment, you get a better social environment. It helps along many different dimensions in the process. And this is just, again, reiterating, I think, the wonderful messages that you've heard earlier, and just trying to reinforce those messages. This is ultimately, back to the same slide I showed you at the beginning. We know what the problem is. And frankly, I think we've got some really good solutions based on science. It's now, the real challenge is now implementation, and full implementation. Some of the communities around the country are very creative and have taken up this activity quite well. Some of the teachers accept the responsibility, the challenges that go along with this because they see the benefits. Some of the principals and superintendents still fussing around the, is it going to cost us something? Is it going to be more complicated? I mean, there used to be some challenges with not the culinary service people, but frankly with the janitorial services. They were worried about what are they going to do with all this trash, and what are they going to do with, spilled milk all over the place, and what are they going to do with all this food? And frankly, they've come around to this as a real solution, and we figured out much more efficient ways to sort of deliver the product and make this work. And I think we have to sort of continue to do it. But ultimately, the secret of our success is really involving all of us, supporting parents and teachers in the school, and frankly from the hardworking farmers that are helping us with good quality food and food products, and from the, in my lifetime, I think we went from cooks to, I think chefs are the #1 aspirational, at least I watch enough of the Food Channel and all those channels that, becoming a chef is a real learned kind of thing. And frankly, I think one of the other challenges is to integrate all of this stuff. I mean, I grew up learning about, my math problems were, mom gives you a nickel, and how much penny candy can you buy for a nickel? Well, maybe we should change that. It's got to be more than a nickel now. It's got to be maybe $5. But it's how much fruit and vegetables can you buy, instead of that subliminal message that it's sort of penny candy. And those messages should be in the math department, they should be in the science department, they should be in the social studies department. I mean, food and nutrition is sort of, needs to be part of the academic continuum, and appreciating, frankly, who's behind all. I mean, I ask even some of my graduate students, where does some of this food come from? And the #1 answer is the grocery store, not the animal or the farm where it originates. We've sort of disconnected all of that. So the issue is to bring this all back together, and ultimately what we're here about is to appreciate the incredible importance and how simple and straightforward it is. We rarely have that kind of straightforward solutions to some of these big problems. I mean, breakfast is the solution, and breakfast in the classroom is a very effective way to deliver this kind of effort and activity. Hopefully I haven't confused you, but given you a little more information, and if there's questions that many of you have more knowledge about some of these things than I do, I can, I think I can still spell ATP. So questions, issues, comments?
So we will see if there's any questions live streaming, and I know there's a little lag in that, so we'll wait a little bit for questions. But any questions for Woody?
Can't have been that clear. Usually, usually you have to make up some sort of question or some sort of comment. But you've all, I think the fact that you're here, you're committed to trying to find a resolution. And in many ways, it's like we want to get to your colleagues when you go back home to try to help them understand how important this all is and how straightforward, again, all of this is. I don't want to belabor this, but again, I want to thank the Dairy Council for caring enough about the future generations of the kids in this country to support these kinds of events, and the importance of, putting forth good nutrition and breakfast in school and the classroom. Yay! You get a free lunch but it's got to be an easy question. If it's a hard question, somebody else is going to.
This is an easy one, I think. I am from the Statewide School Health Services Center, and I direct support for school health in New York State from the State Education Department. And one of the things we see from school nurses is this question, and I see you're from the educational area, is the education that, let's say, upcoming physicians, and we're doing the same for nurses, but mostly at the physician or provider level, so that's physician or NP in New York State, at the point of service when families go in, how is that reflected in ongoing education? Because sometimes the schools are part of it, but what we see is kids coming back, we do BMI surveys, and I guess as nurses we're questioning, where's the provider, where's that discussion with the family when they're going in for the well-child checkups and this kiddo's coming back? How do you see that changing? I know that there have been improvements, but that's been kind of behind the medical side, the clinical side. I just wondered if you could talk about what you've seen in the last few years of change in education of providers.
I mean, that's a really very good question. And in fact, I'm pleased to be able to report that there's some positive movement in that. I think nutrition education in schools, I mean, here we are, University of Rochester and Strong is a wonderful leading institution here in this community. And I think at least, well, my colleagues in pediatrics are recognizing the critical importance of nutrition in this whole process. The current president of the American Academy of Pediatrics, Sandy Hassink, is a leader, and her focus, if you will, I mean, she's a primary care physician, but her focus is good nutrition, overweight, and obesity prevention. And she's now leading that charge within the Academy. Well, one of the most important issues that I think is changing in the practice of pediatrics is asking smarter questions. They're asking questions about food. What did you eat? You know, I mean, there's a whole new movement about trying to get at food insecurity and asking it not in a pejorative way, you know, not in a way that's embarrassing or whatever it all is. And it's trying to get at that information as part of the well child check, as part of the important part of growth. I mean, you know, charting heights and weights was notoriously there. I'm not sure I understood what a BMI was for a long time, but at least we would chart. It's what kids do. They grow and they develop, and we would chart all of that. But now we're asking better questions. Tell me what a typical meal involves. I'm not sure all the pediatricians quite understand, you know, the nutrient value and understanding, you know, all of that. I think that's growing and getting better. But asking good questions is improving. I think the second part is, just as we recognize that the practice of medicine is a partnership with nursing and child development experts, we're now recognizing the nutrition person as part of that team as well. I mean, I'm excited that I think there's really good progress. Now, because I've come from another meeting, I will tell you, in some states, the state has gotten involved in some of this well child care. And in the state of Florida, for example, I can lose my license and be fined if I ask about gun safety. So it's a funny, you know, involvement in this whole process. That's not whether you should or shouldn't have a gun in the home. There's a whole, but is it safe? Is it locked up? Is it secure? Kids are inquisitive beings. They play with things. They look like toys. And 11 kids a day are dying from gunshot wounds. So while in some ways we're making a lot of progress, and I'm excited that part of this is now being incorporated into medical education, taking a team approach along and asking better questions. You know, when you come in for a well child check, it isn't just let me look in your ears and let me, you know, look. It's, you know, how are things going? How are you doing? I mean, even encouraging, you know, frankly, pediatricians' knowledge about programs that are available in the community is increasing. That's another responsibility that we have, saying, well, you know, there's programs. Breakfast in the classroom may be available for you in your community. Why don't you check it out? Your parents can do some. So the energy is positive in that regard, and thank you for that question. I mean, I think we've not done a good job for a while, and I think we're taking on that responsibility in some of the superb programs like the ones here in Rochester, and certainly Syracuse and Buffalo. All of Western New York are leading the ways in some of those things.
One comment before a question, and maybe a question for you, Woody. We at American Dairy Association and Dairy Council really value our partners, and we actually refer to them as powerful partnerships. And I would love to hear from Woody personally, what is the best way to really, because we have a lot of people doing similar things in the school districts, outside of the school districts, with pediatricians. How do we all work together to kind of combat this battle that we have and work better together? Because I would love pediatricians in the same room as American Dairy Association, in the same room as school nutrition directors, in the same room with New York statewide school health services, because we are doing similar things that we need to be doing this together to be able to have more of an impactful approach to this battle, if that makes sense. Any words of wisdom?
Yeah, again, Michelle, you're absolutely right. It's back to that issue of it takes all of us to sort of collaborate and, you know, use our strengths and realize that. I mean, I think one of the things, quite honestly, that I'm equally proud of with what the Dairy Council has supported, Tom McInerney who's a pediatrician here at Rochester, was president of the American Academy of Pediatrics. Tom was also one of the first to respond after the tragedy in Newtown, but we've had several meetings with Tom, sponsored by the Dairy Council, to come together and talk about how do we get the practitioners, how do we get academics, how do we get the hospital, how do we get the schools, how do we get the farmers, the schools, service, all. Interestingly enough, the good news here is we all want the same thing. We do indeed have those common goals. The question is how to support, one another in the process, and I think that that's working well. And I think, we were at again, an event that the Dairy Council facilitated, bringing the chapters of the Academy of Pediatrics with the school. This was in New York City at the New York Academy of Medicine, trying to increase these conversations, increase this dialogue. Critical is, sort of, school nursing, and having school nurses take on, frankly, a bigger role, not just, I don't feel well, and, the classic paradigm of I don't feel well, and the nurse says, it's a cross between, did you eat? Are you a malingerer? What's, what, I had a test today. It's all, we've all been down these, down these paths, but I think it's really reinforcing that, and I think it is this issue of coming together as a community. Pediatrics has this thing called community pediatrics, where it extends itself beyond the office, extends itself beyond the hospital, and involves all the assets, again, in the community. My students are now learning about all the food nutrition programs, all the support programs, all the infrastructure in the communities. Again, it's because of that issue of, gee, that's pretty enlightening. I can write a prescription for Popeye's spinach instead of, a chemical. That was really sort of, I love that idea. I used to write prescriptions. I mean, I would certify, the #1 diagnosis in America, in the world, this is inside baseball, is rule out. Rule out this, that, and the other thing. You can be admitted for anything if rule out X. So that's the reason you get admitted to the hospital. I'm being a little exaggerated here, but I would write down rule out something to certify that the child should get a WIC evaluation. I mean, frankly, I didn't know. I didn't do the biochemistry to, prove what the anemia was. But I would refer, because I loved the WIC program, was such an invigorate. It put food with health, with good nutrition education. It just sort of was a wonderful, wonderful program. But I do think that these kinds of meetings involving, now what's hard is sometimes you have to do nights and weekends if you want to get, the busy pediatricians. If you want to get the school educators, you have to do it a different way. You have to figure out how to bring sort of people together. But it's people like I think like the Dairy Council and others are really recognizing that we bring these folks together, we have common goals, and we can achieve those goals by simply learning and frankly, working and understanding and coming together with it. So it's, I think it is improving. It's still going to take work. You can't write, take an aspirin and call me in the morning and we've solved the problem. It's sort of an ongoing, continuing activity. Frankly, there's even some wonderful programs that I know about where young people studying nutrition and folks in medicine are coming together to do rounds in the hospital. So we're learning about, all of these kinds of things. Lots of, I showed you some of the diseases. They have nutrition-based either causes or solutions, or maybe a little bit of both. And the value of understanding, the classic disease is diabetes, involving, good nutrition choices and education. And I think we're learning that students of all the disciplines coming together can really make a bigger difference in the process. It's complicated because we don't have reimbursement exactly for nutritionists. We're not quite there yet. So there's the other solutions. We're so far afield from some of the things, but nonetheless, all these systems have to sort of come together. But I think I'm optimistic. It's just going to take a lot more energy and work and some good folks facilitating these kinds of conversations where people, in New York City, it was classic. The pediatricians were fussing with the educators. You don't do your job, and you don't do your job, and whose fault is this, and why is why is there not PE during the school day anymore, and why is there so much homework they can't do this, that, and the other. So we're sort of learning it takes a systems approach to this kind of thing.
Dr. Kessel, you've mentioned a lot of, working with nurses and other pediatricians and educators, but I'm wondering, as a pediatrician who clearly cares about nutrition, how often do you work with registered dietitians, whether it's in the clinical or community realms?
The short version is not enough. The longer version is it's getting much better, because I think what we're all beginning to realize, and when I was in the federal government and running some of these programs, we tried some experiments about having a nutritionist in the office as a demonstration project, and how was that going to work. And that would be sort of up front. There's an approach to disease prevention and health promotion called Bright Futures that the American Academy of Pediatrics has taken up. And Bright Futures is really, it's a label for, we call different things in child care. But it's really showing how sophisticated it can be, and there's a whole, I don't like to value things in terms of how many inches in the Bright Futures book is dedicated now to nutrition. But I can do it from a different perspective. It used to be that it was 0. And now there's a whole Bright Future section on high quality nutrition and the importance of using talented and bright people to collaborate with. But there's still some challenges. The reimbursement model doesn't quite support that. It's simpler and easier for me to prescribe insulin and for you to get the insulin than it is for me, it's like the WIC program. That was a cognitive epiphany of some ways, to write a prescription for food. We don't really have that and that's another, I think, challenge that we can do. But I think the good news is it's starting with younger people. The information age is helping us a little bit about all of that. And I think interprofessionally, it's recognizing how much more you know and how little I was educated, and what the subtle benefits are. And I think the other part of this is, and I want to go to the really practical part, we don't eat nutrients, we eat food. And so the whole issue of food purchasing and preparation and making it taste good and look good and all of those kinds of things that our chefs and our culinary people, we have to bring all of these things sort of together, because the solution for me isn't a pill. The solution is good quality food. And I think what nutritionists are bringing, they're bringing some of the talents on food preparation in addition to just what those nutrients are. I mean, we had a lovely lunch. I mean, I don't know anything about the nutrients in the lunch, but it looked good, it tasted good, there was variety, there was good choice, and those kinds of things. So I'm optimistic. It's still going to take work, and I think one of the biggest challenges is going to be, how do you reimburse for and pay for? Some practices, some of my colleagues are actually hiring nutritionists because they know enough about how important that is and how little they know. So they're sort of taking it out of overhead, for lack of a better term. But since medicine is all about reimbursement and complex financing, that's still going to be the quote challenge. And the biggest challenge is going to be to get away from the disease-based approach. I mean, it's one thing to write down, you're a diabetic, and maybe in some insurers you can justify, 2 nutrition visits. But how do you justify it as basic part of health promotion and disease prevention, which is, what we've shown up here on the slides, and what, frankly, starting the day off with good nutrition is about health promotion and disease prevention. I mean, it's so inherently rational we don't do rational things anymore. You know, we're in a different process here. But you know, I'm a bit optimistic. I mean, there's good programs around the country trying to educate young people in practices that appreciate. We have something in pediatrics that we now call the medical home. I didn't love that term because I didn't want you to go to the home and leave with medicine. I wanted to call it a health home, but it really is functionally a health home, which is trying to bring all these pieces together, and it includes nutrition. Not working all over the place, but I think folks are appreciating that it isn't, you know, take an antibiotic here and, you know, fragmented care doesn't work. It really has to be family-centered kinds of care and thinking about, you know, what we would all want. I mean, I think if we project on ourselves what we want, you want high quality, comprehensive care. Answered lots of funny questions this time, but.
Any other questions? Well, put your hands together, please, for Dr. Woody Kessel.
Thank you.
I really appreciate your presentation and all of the answers to the questions that were asked. We're going to take a quick break right now, about 5 to 10 minutes, and come back with our panelists to be able to ask them some questions.